Hello everyone, myself Govindas Pute, lecturer at Pravata Medical Trust College of Pharmacy, Shivagaon. Dear friends, in last lecture we start the chapter that is the semi-solid dosage form, suppositories and pessaries. In this lecture we discuss about the what is the suppositories, what is the advantages and disadvantages of suppositories. First of all, what is the suppository? Suppositories are solid dosage form of medicament for insertion into body cavities other than mouth. They may be inserted into rectum, vagina or nasal cavity. The medicament is incorporated into the suppository base and the product is formulated in such a way that they will either melt or dissolve in the body cavity fluid to release the medicament. Suppositories are available in different shapes, size and weights. It also used to produce local systemic and mechanical action. Then what are the advantages of suppository? This can be easily administered to children, old person and to unconscious patient who cannot swallow the drug easily. Second, these are inserted into body cavity to produce local effect of the medicament incorporated in the base. Third, these are inserted into the rectum to exert a direct and rapid action on the rectum. Fourth, these are inserted into the rectum to promote evacuation of the bowel. Third, suppositories are unit dosage form of drugs. 7. Drugs in suppositories are slowly absorbed, giving sustained action. And last advantages of suppository is it is convenient mode of administration of drugs which irritate gastrointestinal tract, cause vomiting and destroy in the acidic pH of the gastric juice of stomach. Then suppositories have some disadvantages as like it is the irritant drug cannot be administered by this route. It causes embarrassment to the patient when a drug is administered by inserting a suppository into the body cavity. Suppository cannot be prepared easily and suppository are required to store at low temperature as like 10 to 20 degrees Celsius. Hence suppository are required to store in a refrigerator which is costly for the poor patient. Then types of suppository: rectal suppositories, these are meant for introduction into the rectum. Vaginal suppositories, these are meant for introduction to the vagina. Nasal suppositories, these are meant for introduction into the nasal cavity. Urethral suppositories, these are meant for introduction into the urethra. Air cones, these are meant for introduction into the air. Then new traits of suppositories: tablet suppositories, layered suppositories, capsule suppositories, coated suppositories and disposable mouths. Up to here we discuss in last lecture. Now in this lecture we discuss about suppository bases. The various type of suppository bases are used to prepare suppositories so that they can retain its shape and firmness during storage and administration. They should melt or dissolve in body cavity fluid when inserted into the body cavity. सपोजिटरी बनवण्यासाठी वेगवेगळ्या बेसचा सपोजिटरीच्या बेसचा वापर केला जातो आणि सपोजिटरी बेसमुळेच ज्या सपोजिटरी आहेत त्यांचा साईज, शेप आणि वेट त्याचं मेंटेन राहतं. आणि ज्यावेळेस सपोजिटरीज मेल्ट होतात, मेल्ट झाल्याच्या नंतर त्या बॉडी कॅव्हिटीच्या फ्लुइडमध्ये डिझॉल्व होतात आणि डिझॉल्व झाल्याच्या नंतर दॅट इन्सर्टेड इन टू द बॉडी कॅव्हिटीज. मग त्यासाठी त्यांनी काही प्रॉपर्टीज सांगितल्या जे की तुम्ही स्लाईडवरती पाहू शकता. फर्स्ट प्रॉपर्टी काय आहे? इट शुड मेल्ट ॲट बॉडी टेम्परेचर ऑर डिझॉल्व ऑर डिस्पर्स इन बॉडी फ्लुइड्स. बॉडी टेम्परेचरला काय झाले पाहिजे? सपोजिटरी मेल्ट झाल्या पाहिजे. मेल्ट झाल्याच्या नंतर त्या बॉडी फ्लुइडमध्ये डिझॉल्व झाल्या पाहिजे आणि डिझॉल्व झाल्याच्या नंतर त्या बॉडी फ्लुइडमधनं डिस्पर्स पण झाल्या पाहिजे. ह्या त्याचं फर्स्ट आयडियल प्रॉपर्टी आहे सपोजिटरीची. काय आहे? टू मेल्ट body at body temperature, dissolve or dispense in body fluid. Then second, should be keep its shape when being handled. जेव्हा हँडलिंग होते किंवा ज्यावेळेस त्याचे ट्रान्सपोर्ट होते त्यावेळेस त्याचा जो शेप आहे तो शेप परमनंट राहिला पाहिजे, त्या शेपमध्ये काही डिस्टर्बन्स किंवा काही चेंजेस झाले नाही पाहिजे. देन इट शुड रिलीज मेडिकामेंट रिएडली, त्याने लगेच मेडिकामेंट रिलीज केलं पाहिजे. त्यानंतर इट शुड बी नॉन टॉक्सिक अँड नॉन इरिटंट. कशा असल्या पाहिजे? सपोजिटरीज या नॉन टॉक्सिक आणि नॉन इरिटंट असल्या पाहिजेत. देन म्हणजे म्युकस मेम्ब्रेनना आपण कुठे इन्सर्ट करणार आहे? त्या बॉडी कॅव्हिटीजमध्ये इन्सर्ट करणार आहे. मग त्यांनी बॉडी कॅव्हिटीला कसल्याही प्रकारचा टॉक्सिक इफेक्ट किंवा इरिटंट इफेक्ट दाखवला नाही पाहिजे. इट शुड बी स्टेबल ऑन स्टोरेजवरती त्या स्टेबल असल्या पाहिजे, म्हणजे सपोजिटरी बेस हे स्टोरेजवरती स्टेबल असले पाहिजे. देन इट शुड बी कम्पॅटेबल विथ लार्ज नंबर ऑफ ड्रग्स. कितीही ड्रगचं कॉम्बिनेशन सपोजिटरीमध्ये दिले तरी ते कसं असलं पाहिजे? कॉम्पॅटेबल असलं पाहिजे. इट शुड बी स्टेबल इफ हिटेड अबाउट इट्स मेल्टिंग पॉईंट. मेल्टिंग पॉईंटच्या वरती पण जर हीट झालं तरी पण ते काय असलं पाहिजे? स्टेबल असलं पाहिजे. अँड इट शुड बी गुड इन ॲपिरन्स. त्याचा ॲपिरन्स पण कसं असला पाहिजे? गुड असला पाहिजे. अँड लास्ट वन, इट शुड बी इझिली मोल्डेड बाय पोरिंग ऑर कोल्ड कम्प्रेशन. ती मोल्ड पण साईजमध्ये किंवा जे काही मोल्ड असेल, मोल्ड बेसेस ह्या इझिली मोल्ड पण झाल्या पाहिजे. दीज आर द आयडियल प्रॉपर्टीज ऑफ द सपोजिटरी बेसेस. देन नेक्स्ट, क्लासिफिकेशन ऑफ सपोजिटरी बेसेस. सपोजिटरी बेसेसचं क्लासिफिकेशन ब्रॉडली 3 कॅटेगरीमध्ये केलं आहे. फर्स्ट वन फॅटी ॲसिड, सेकंड वन वॉटर सोल्युबल अँड वॉटर मिसिबल बेसेस, अँड थर्ड वन इमल्सिफाईंग बेसेस. समजलं आहे? ब्रॉडली केलेलं आहे सपोजिटरी बेसेसचं क्लासिफिकेशन 3 क्लासमध्ये. फॅटी बेसेस, वॉटर सोल्युबल अँड वॉटर मिसिबल बेसेस, इमल्सिफाईंग बेसेस. नाउ डिस्कस वन बाय वन. फॅटी बेसेस इन विच थिओब्रोमा ऑइल. Theobroma oil is yellowish white solid obtained from crushed and roasted seeds of Theobroma coca. Theobroma oil कशापासून मिळवलं जातं? Theobroma coca हे जे काही सीड आहे त्या सीडपासून थिओब्रोमा ऑइल बनवलं जातं, ज्याचा कलर येलोविश व्हाईट आहे. आणि यालाच काय म्हटलं अजून? कोका बटर पण म्हटलं आहे. इट इज ऑल्सो कॉल्ड ॲज कोका बटर. इट ऑल्सो नोन ॲज कोका बटर. देन इट हॅज बटर लाईक कन्सिस्टन्सी हॅविंग मेल्टिंग पॉईंट 30 to 35 डिग्री सेल्सिअस. याचा टेम्परेचर मेल्टिंग पॉईंट किती आहे? 30 ते 35 डिग्री सेल्सिअस. इट इज अ मिक्सचर ऑफ ग्लिसरॉल इस्टर ऑफ स्टेरिक, ओलिक, पॅलेमेथिक अँड अदर फॅटी ॲसिड. थिओब्रोमा ऑइल मेल्ट्स ॲट बॉडी टेम्परेचर अँड रिलीज द मेडिकामेंट फॉर रॅपिड ॲब्सॉर्प्शन. It is considered a most suitable base for rectal suppositories but not suitable for pessaries, nasal and urethral bogies, because after melting it has a tendency to leak out the cavities, and also it is immiscible with mucus secretion. It is readily liquefy on warming and quickly settle on cooling. It is all about the theobroma oil. Then some advantages of theobroma oil, like coca butter has most of the qualities of an ideal suppository base, but still it has number of serious disadvantages. Like first, it show the phenomenon of polymorphism, that is when theobroma oil is melted and cooled, it gets solidified into different crystalline forms depending upon melting temperature, rate of cooling and size of the mass. Then second, it becomes rancid and melts in warm weather. Next, it is relatively costly. Then it is miscible with body fluids. It is immiscible with body fluids. Then it has a tendency to stick to the sides of mold when solidified. Then it leakage from body cavities on melting can take place. And also certain drugs such as chloral hydrate, lactic acid, when incorporated with coca butter, liquefaction take place. To maintain the desired consistency, the beeswax can be added. Next one example of the fatty base is the emulsified theobroma oil. This may be used as base when large quantities of aqueous solution are to be incorporated. The use of 5% glyceryl monostearate, 10% linate wax, 2 to 3% cetyl alcohol, 4% beeswax and 12% permicet is recommended to prepare emulsified theobroma oil suppositories. Then third one is the hydrogenated oils. These hydrogenated oils are obtained from hydrogenation of various vegetables oils such as arachis oil, cottonseed oil, coconut oil, palm oil. It is used as a substitute for theobroma oil because it has number of advantages over the theobroma oil. First advantage over the theobroma oil is they are resistant to oxidation. Second, lubrication of the mold is not required. Third, overheating does not affect the solidifying point. Fourth, they produce colorless, odorless and elegant suppositories. Last one, the emulsifying and water absorbing capacities are good. Some disadvantages, like suppository become brittle on rapid cooling in refrigerator. Then they are more fluid than theobroma oil when melted, so there is greater sedimentation of the added substances. This difficulty can be overcome by adding some thickening agents such as bentonite magnesium stearate. This is the overall class about the fatty base. In fatty base they give the three examples like theobroma oil, then emulsifying theobroma oil and hydrogenated gel oils. मग थिओब्रोमा ऑइल कसं ऑप्टेन होतं आहे थिओब्रोमा कोका किंवा कोका बटरपासून, कोका बटरच्या सीड्सपासून किंवा थिओब्रोमाच्या सीड्सपासून थिओब्रोमा ऑइल तयार होते ज्याचा की कलर येलोविश व्हाईट आहे. त्यानंतर इमल्सिफाईड थिओब्रोमा ऑइल कसं तयार होतं आहे, हे जे काही थिओब्रोमा ऑइल आहे यामध्ये 5% ग्लिसरीन मोनोस्टेरेट असतं, 10% लिनेट वॅक्स असतं, 2 ते 3% सिटिल अल्कोहोल असतं, 4% बीजवॅक्स असतं आणि 12% स्पर्मिसिट असतं. एवढे सगळ्यांना एकत्र घेऊन इमल्सिफाईंग थिओब्रोमा ऑइल तयार होतं. त्यानंतर हायड्रोजनेटेड ऑइल कसं तयार होतं आहे, हे हायड्रोजनेशन व्हेरियस जे काही भाजीपाला आहे जसे ॲरेचिस ऑइल असेल, कोकोनट ऑइल असेल, त्यानंतर कॉटन सीड ऑइल असेल, पाम ऑइल असेल, याच्या हायड्रोजनेशनपासून हायड्रोजनेटेड ऑइल तयार होतं. ठीक आहे, हे कशाच्या अंडर पाहिलं आपण फॅटी बेस्ड आहेत, त्याचे काही ॲडव्हान्टेजेस डिसॲडव्हान्टेजेस पण पाहिले. देन नेक्स्ट क्लास ऑफ द सपोजिटरी बेस इज द water soluble and water miscible bases. In which water soluble and water miscible bases, first is the glycerogelatin base. पहिला बेस कोणता सांगितला आहे, ग्लिसरोजिलॅटिन बेस. या बेसमध्ये काय सांगितलं त्यांनी की इट इज अ मिक्सचर ऑफ ग्लिसरीन अँड वॉटर विच इज मेड स्टीप बाय द ॲडिशन ऑफ जिलॅटिन. The base may be used for preparing all type of suppositories, but it is particularly used for मेकिंग पेसिसरीज. हा बेस ग्लिसरोजिलेटिन बेस हा सगळ्या प्रकारच्या सपोजिटरीज बनवण्यासाठी यूज केला जातो, पण जास्त कशासाठी पण यूज केला जातो, पेसिसरीसाठी पण यूज केला जातो. आणि इट प्रिपेअर फ्रॉम ग्लायकोजिलेटिन बेस आर ट्रान्सलंट विच टेंड टू डिझॉल्व और डिस्पर्स स्लोली इन द बॉडी कॅव्हिटी अँड रिलीज द मेडिकामेंट. हेन्स द बेस इज प्रेफर्ड ओव्हर फॅटी ॲसिड और फॅटी बेस. ग्लिसरोजिलेटिन बेस इज वेल suited for suppositories containing boric acid, chloral hydrate, bromides, iodines, iodoform, opium, etc. Then to avoid the incompatible reaction, any one of the two types of gelatin are used as a suppository base. First, type A or Pharmagel A, which is acidic in nature and used for acidic drugs having isoelectric point. Then type B or Pharmagel B, which is alkaline in nature and used for alkaline drugs having isoelectric point 4.7 to 5 and इकडचा isoelectric point 7 to 9. Then it have some disadvantages like the solution time depends on the content and quality of gelatin used. Then gelatin is incompatible with many drugs such as tannic acid, ferric chloride, gallic acid. Then there are more chances of bacterial and mold growth Therefore, a suitable preservative is required to preserve the suppositories. The suppositories prepared with glycogelatin base are hygroscopic and hence require special storage containers. They have a psychological action. Glycero suppositories BP is used as a laxative and they are more difficult to prepare and handle. Then next one is the soap glycerin suppositories. Under this point they say in glycerol gelatin base the gelatin is replaced with either curd soap or sodium stearate, which makes the base sufficiently hard to prepare good quality of suppositories. Soap also helps in the evacuation action of glycerin. The some main disadvantages of this base is that they are very hygroscopic. Therefore, the suppository prepared with this base must be protected from atmosphere and wrapped in wax paper on or tin foil. Then third one, polyethylene glycols. Polyethylene glycols polymer are commonly known as carbowaxes or polyglycols or macrogols. The physical character of these carbowaxes varies according to the molecular weight. The macrogols having molecular weight less than 1000 are liquids and those with molecular weight higher than 1000 are wax-like solids. It has some advantages like they are chemically stable. Polyethylene glycols are chemically stable. Then polyethylene glycols are non-irritant. They do not allow the bacterial or mold growth to take place. Then they are physically inert substance. Then physical properties of the base can be changed according to the need by combining the different proportion of high and low and high melting point polymers. They provide prolonged action because they do not melt in the body cavity but dissolve slowly for a long time. They do not stick to the side of the mold and suppository made from macrogols have clean and smooth appearance. Disadvantages like they are hygroscopic and hence require special storage condition to store them. They are incompatible with certain drugs like tannins, phenols. Then its good solvent properties can result in retention of the drug in the liquefied base in the body, thereby reducing their therapeutic activity. Last disadvantages of polyethylene glycols, that is the high solubility of macrogols leads to supersaturation, which in turn make crystal and fracture the product on storage. These are the disadvantages of polyethylene glycols and overall about the water soluble and water miscible base. Under this point they say the three examples glycerogelatin base, then soap glycerin suppositories and polyethylene glycols. In glycerogelatin base, it is the mixture of glycerin and water. In soap glycerin suppositories, it is the gelatin replaced with card soap or sodium stearate. And polyethylene glycols means it is the commonly known as carbowaxes and polyglycols and macrogols. Then next one class is the all about polyethylene glycol discuss. Next one class is the emulsifying bases. These are synthetic bases and a number of properties synthetic bases are available in the market. For example, white sole, mesa-asterinium or mesapol. in which they say white spole, they consist of triglycerides of saturated vegetable acid with varying percentage of partial ester. A small amount of beeswaxes is added for use in hot climates. The suppositories prepared with white spole base should not be cooled rapidly in order to prevent them from becoming brittle and fracture. The mold should also be poured properly lubricated to get good qualities of suppositories. Then macisternum, it is the mixture of mono, di and triglycerides of saturated fatty acids having the formula C11H23COOH. It is also known as Adapts solidus. Then next one is it is white, brittle, almost odorless and tasteless solid. It has a melting point 33.5 to 35.5 degrees Celsius. They are available in various grades, but grade B is commonly used in dispensing. Miscible consists glyceryl ester mainly of lactic acid, to which small amount of glyceryl monostearate has been added to improve its water absorbing capacity. Then advantages over theobroma oil: it is solidified rapidly, then they are non-irritant, then lubrication of mold is not required. Next, overheating does not affect the physical properties of the base. Then they can absorb fairly large amount of water or aqueous liquids. Then they are less liable to get rancid. Then white, colorless, clean and attractive suppositories are produced. Some disadvantages, like they should not be cooled rapidly in refrigerator because they become brittle. And next disadvantage is that they are not very viscous on melting, so the medicaments incorporated with the base settle down rapidly. These are the disadvantages of emulsifying bases. In this lecture we discuss about the overall suppository bases. The suppository bases are various types to use to prepare suppository, so that they can retain its shape and firmness during storage and administration. They should dissolve in body cavity fluids when inserted into body cavities. Then ideal properties. Then broadly classification on the three class: fatty bases, water soluble and water miscible bases, and emulsifying bases. Under fatty bases, again some sub point theobroma oil, then emulsifying theobroma oil and hydrogenated oils. The water soluble and water miscible base is the main second class of suppository base. Under this point, again some class like glycerogelatin base, then soap glycerin suppositories, polyethylene glycols. Then last main third class of the suppository base is the emulsifying bases. Remaining will be discussed in next lecture. Thank you.